Respira en la maravilla, la grande despertó, pero estaba en dormir. Respira en la maravilla, tomes caricias, primera me agasalé. Respira en la maravilla, todas mis coroneras, fui primera en Huentadino. Respira en la maravilla, tome la ello, huías y tasarlo con estilo. Deseado silencio, sin mi amor ahora abstención. Respiro, te llamará a ti, copecera de los labios, para ti sin estación. Respiro, te llamará a ti, y llamará a mí, y apaga.
everyone. Welcome. My name is Dawn Walker, and I am Vice President of Communications and Marketing here at Downstate. I'm really excited to see you all here. I'm very happy that we can come together for yet another important conversation here at Downstate. Before we begin, and I've done it myself this time, please make sure that your phones are on vibrate. Restrooms are outside, or actually they're back there. So if you need them, please let us know, or not let us know. Please help yourself. We're going to be going through a great conversation today. There will be a Q&A at the end of this. But before we start, I want to make sure that I bring greetings on behalf of Dr. Riley, our president. He's unable to be here today, but he extends his warmest appreciation to our faculty, students, staff, and community who are celebrating Hispanic Heritage Month. This observance, which began in 1968 and expanded to a month in 1988, honors the profound influence of Hispanic and Latino communities, shaping our local, national, and global stories. It aligns with the independence anniversaries of several Latin American nations whose perseverance reflects the same strength seen across Brooklyn today, and of course in Brooklyn. Nearly 1 in 5 Brooklyn residents, over 500,000 people, identify as Hispanic or Latino, Puerto Rican, Dominican, Mexican, Central, or South American. And these families enrich every aspect of our civic life, from public service to healthcare and innovation. Yet, inequities exist. Hispanic adults are twice as likely to be uninsured as white adults, and chronic disease disparities often stem from systemic inequities, not personal choices. Today's panel, Latino and Underserved Community Leadership in Public Service and Health Equity and Access, challenges us to look beyond statistics toward solutions, building partnerships that unite, that unite health, housing, and justice in pursuit of true equity. Downstate proudly advances the SUNY Diversity, Equity, and Inclusion Action Plan, including initiatives such as our Diversity, Inclusion, and Equity House Staff Council, which ensures that our workforce reflects the communities we serve. But our mission goes beyond policy. It's very personal. Serving Brooklyn means that serving all who make it strong ensures that future healthcare leaders, many first-generation students, see themselves represented here. We will continue to celebrate Hispanic heritage as a living commitment to equity, access, and partnership. Our panelists, Dr. Marlene Camacho Rivera, President Elizabeth De Leon of Gutman Community College, Dr. Jose Diaz, and Kevin Garcia, we want to thank you for exemplifying that commitment. And to everyone in here in person and online, thank you for helping Downstate lead with compassion, keep care close, and making excellence inseparable from inequity. I wanted to give a special shout out to our friends at CUNY and to the Environmental Justice Alliance. Now let's get down to business. I'm delighted to welcome Dr. Charles Bernacardi, Dean of the College of Medicine, who will introduce today's moderator. Dr. Bernacardi, thank you.
Good morning, everyone. Before I begin, I'd like to congratulate Dawn for putting on these events, which are so special. While we spend our days so busy taking care of patients, research, teaching, administrating, that once in a while you have an event like this where you take a break and think about why we're here and what we're doing. So, Dawn, congratulations. This is wonderful. Yeah. So, good morning, everyone. I'm Chuck Bernacardi. I have the honor to serve as the Dean of the College of Medicine. You may or may not know I trained here in general surgery, so I'm here because of the outstanding training that I got back in the 80s. I'd like to welcome to our Hispanic American Heritage Month panel discussion, Latino and Underserved Community Leadership in Public Service, Health Equity, and Access. Today's conversation reflects Downstate's mission as an institution grounded in diversity, dedicated to service, and committed to delivering equitable care to our communities. I'm so proud to be a part of Downstate and to work with all of you. It's just it's wonderful to be here. Before I introduce Dr. Guillen, I'd like to extend a special thank you to our panel and to acknowledge their commitment to working for the betterment of our communities. Now it's my great honor to introduce Dr. Christina Guillen, who's our new interim chair of the Department of Pediatrics and who has spent her entire career at Downstate. Dr. Guillen earned her medical degree at SUNY Downstate and went on to complete both her pediatric residency and chief residency at Downstate. She has since devoted her career to advancing pediatric education, community advocacy, and health equity. Over 20 years in academic medicine, Dr. Guillen has served as the program director of the pediatric residency program. And as we know, that's one of the hardest jobs in the university. She served as vice chair of education and also the associate DIO in graduate medical education. As a director of the Pediatric Community Advocacy Division, she strongly believes in building partnerships that strengthen the link between healthcare and community well-being across Brooklyn. She developed a health disparities curriculum for residents and better understands the importance of serving truly unique and diverse communities. A second-generation Dominican American who grew up in Washington Heights, Dr. Guillen served as the 2023 SUNY Hispanic Leadership Institute Fellow, highlighting her outstanding leadership and mentorship. She also serves as the chair of the New York City chapter of the National Hispanic Medical Association. Dr. Guillen understands deeply the importance of language, culture, and shared understanding in delivering equitable care, especially in diverse communities like ours. Her leadership exemplifies how Downstate's mission comes to life through action, empathy, and education. So please join me in welcoming an inspiring leader and champion of equity, Dr. Christina Guillen.
Thank you so much. I feel like I'm with familia right here, right? Which is great. So buenos dias, everyone. Buenos dias. Thank you, Dean Brunacardi, for that lovely introduction. I'd like to thank President Riley and Dean Brunacardi for their leadership and ensuring that SUNY Downstate Health Sciences University remains committed to diversity, inclusion, and equity. And then I would also like to thank Dawn Walker for the outpouring of love that you've given to this event. I've been working with you, and we've had 2 or 5 or 6 revisions of the questions because they have to be right. And we here come together to celebrate Hispanic culture and our leaders. So today's program is, excuse me, powerful and fitting to close our Hispanic Heritage Month, right? So it's always how we start and how we end. By uplifting voices, celebrating leadership, and advancing the critical conversations that move our communities forward. This panel discussion explores how Hispanic leaders are reimagining public service, research, and community planning to address persistent disparities in health access, transportation, and equity. By highlighting the leadership of our panelists across diverse fields, this discussion celebrates cultural innovation and resilience while challenging the systemic inequities that continue to shape health outcomes in Hispanic communities. So it is my pleasure to introduce our panelists. So I'm a little bit out of order, I'm so sorry. So first is Dr. Marlene Camacho Rivera, is the Assistant Dean for Student Affairs and an Assistant Professor of Community Health Sciences at SUNY Downstate School of Public Health. She's a social epidemiologist whose work examines the structural and social determinants driving chronic diseases inequities in urban, racial, and ethnic minority communities. Dr. Camacho Rivera's research explores within-group heterogeneity in the chronic diseases outcomes amongst Latinos, translating these findings into multi-level, community-engaged interventions with support, chronic disease prevention, and improved self-management. A little personal plug, so I'm getting my MPH, and she is my faculty mentor, and it's such an honor, so. Next, we have is President Elizabeth De Leon Bargava, who serves as the interim president of CUNY's Gutman Community College. She brings over 25 years of executive level and public policy experience across federal, state, and local government to her current role. She most recently served as Assistant Secretary for Administration at the U.S. Department of Housing and Urban Development under the Biden administration, where she oversaw key agency operations and managed a $10 billion federal contracting portfolio. Thank you for coming. Dr. Jose Diaz is a Pride Scholar and Research Assistant Professor in the STAR program and Department of Internal Medicine at SUNY Downstate Health Sciences University. Dr. Diaz's research centers on contextualizing and reducing inequities that impact Hispanic, Latino, Latinx, Latine, sexual minoritized men, including health and healthcare access. His research focuses on examining how geographic mobility is linked to HIV prevention and treatment among immigrant and migrant Latina sexual minoritized men in New York City. Kevin Garcia serves as the Senior Transportation Planner for the New York City Environmental Justice Alliance. His work focuses on advancing environmental justice through reducing transportation-related emissions through public transit improvements and vehicle electrification in low-income communities of color in New York City. I'd like to have a nice warm welcome to our great panelists. All right, so we're gonna start and dive into some questions. So before we begin, I'd like to pause and reflect on something more personal, which is culture itself. Hispanic culture is deeply rooted in family, celebration, joy, heritage, food, music, and pride. In a nation built by immigrants, my question is now posed to you, how do these cultural strains continue to shape our collective growth and development? And how can we better honor the ongoing contributions of Hispanic Americans who make this melting pot stronger every day? Whoever wants to go first. So I'm going to be the teacher. Dr. Diaz.
I got overruled. So when thinking about this, for me, it is important for us to consider, what we're thinking about when we're talking about a community, about a population. Oftentimes when we talk about Hispanic and Latino populations, we think about them as this aggregated group of individuals, the sort of Latino vote, the Latino community. And we often forget that there's so many subgroups and subcommunities within that have their own unique and diverse contributions that they've made to US society, global society, et cetera. So I think that's one of the things that, I'm answering the second part of the question, not the first part, because I was not expecting to go first. But I think that's one of the ways that we can really strengthen our, reflection on the contributions of these populations is by recognizing that we limit our ability to do so by limiting how we think about the populations. I also want to give a small plug because it is, both Hispanic Heritage Month, but also LGBT History Month. They overlap at the moment. So I think, yes, good applause. So I think it's also important to reflect on how people who sit at those intersections also uniquely contribute to our society. So I think about somebody like Sylvia Rivera, who is a prominent member of the Stonewall and Pride movement originally, and how her contributions may get overshadowed when we don't think about people who sit at those intersections. So that's one of my reflections on how we can, strengthen our ability to reflect on the population.
All right. I think it's easy to ditto everything that Jose mentioned. And just to say that being in New York City, I think sometimes we take for granted the contributions of Hispanic or Latino communities because you feel the presence of Hispanic and Latino communities everywhere in New York City, right? You see it on, our streets with respect to almost every bodega or street corner that you see. You see it in our barber shops, you see it in nail salons, you see it in restaurants, you hear the music, you see it in these longstanding and thriving immigrant enclave Latino communities across all boroughs. And so I think it's easy to, again, just understand that it's embedded in the fabric of who we are as a city without, also recognizing the, historical and persistent challenges that Latino communities, have faced. And so I think that it's important for us to continue to recognize that these conversations, that these initiatives, that these movements go just beyond this month. I think many of us jokingly tend to think that our calendars start to get full right around this time. But the work, continues every single day. It's really embedded in what we do here at Downstate and across all organizations here within New York City to improve the lives of not just Latinos, but all communities here within New York City. So I would say the first thing is just to recognize that these conversations and contributions are happening, just beyond this month. We're Latino every day, so we can have these conversations at any point and continue these conversations at any point in time. I think it's important to recognize that, yes, what Jose mentioned is true, that every Latino community has its own very unique social, political context and cultural context that should be respected. But also finding solidarity across movements, I think, is incredibly important because what is happening among Latino and immigrant communities right now, there's a lot of commonalities across other immigrant communities that are being experienced here within New York City. I think other ways that we can better honor the ongoing contributions of Latinos. I think about the fact that we're here at an academic medical campus and the only one that's here within Brooklyn. And that is a tremendous responsibility that we have and a privilege that we don't take lightly. And recognizing the fact that Latinos, represent 20% of the population here within New York City as well as the United States, but Latinos only make up 6% of the physician workforce. There's a huge disconnect there. Latinos make up less than 5% of all public health faculty at academic public health schools and programs here within the United States. And so there's a lot of work for us to continue to do to recognize that, yes, representation is important, but one of the best ways that we can do that is continuing to pay it forward for others.
Hello. Cool. Yeah, just echoing everything that's already been said. I don't know what else I can really add on, but I think really just continuing to learn and learn from other movements and seeing how other communities, move through life and experience every day. As Dr. Camacho Rivera mentioned already, we don't stop being Latino after this month, right? Like we continue to be, Latino, Latinx. So, continuing to learn about, our history, our heritage, our movement, but also learning about other cultures and communities. I think that's really important. And I think also it's super important for us to learn from our elders and try to capture those unrecorded stories as well, through oral history, video recordings, because those are also part of the movement and the story. Yeah.
Thank you. So I actually have been thinking about this question, and in light of what's happening in our country and the world, thinking about the contributions is taking advantage of the opportunity to change the narrative. I think starting a conversation with, the fact that we have to take, the time to recognize the contributions. I was traveling this year and met an individual who happened to also be from New York. And when I introduced myself, I said, "Oh, I'm from New York and we're traveling internationally." And one of the first things he said to me was, "Oh, yeah, I'm from New York. My family has been there for 2 to 3 generations." And I said to him, "Oh, that's so interesting, because So we've been in New York since 1613. Juan Rodriguez, who was from Santo Domingo, was the first immigrant to touch. I'm like, how was it when your family arrived? And I did that on purpose, right? Because one, it's important for us to educate ourselves that we are not new, that these contributions aren't the first time that we became artists and musicians and doctors and lawyers and all these things. And so for me, the most important thing that we can do is start to engage in that real narrative, not allow for people, anyone, to use an educational system as a way to make it seem as if we don't know the ground we walk on.
So I'd like to add to just a little comment. I think, Kevin, the point that you made about knowing our history and our elders is so important, right? Because when we think about our elders, with our elders and with our language comes our history of who we are. So when you stand in a space and you're the only one standing in the space, and to your point, when someone is like, I've been here for, you're like, oh, well, let me tell you about the first Dominican didn't come to Washington Heights, right? But this sense of pride. But the only way you have that pride is if you know your history. No one can rewrite the history that you know, right? So I think it is so important. And I'm going to segue into the next question. So now this is about you as panelists. So now we're going to start exploring where these intersections of your expertise occur and how collaboration can lead to change. Because collaboration is extremely important in our communities. And when you have leaders that are able to collaborate with each other, that is how we're able to uplift our communities. So the first question I'm going to ask all of you is how can leaders in education, housing, healthcare, and environmental justice come together to address the interconnected forces such as poverty, displacement, and climate vulnerability that continue to drive health inequities in Hispanic communities? Jose, you're not going to go first. You're not going to go first. It's going to be Kevin.
I volunteer as tribute this time. Yeah, so I think it's super important to acknowledge that a lot of this, a lot of these issues do intersect, right? And that's sort of what we try to do and acknowledge at NIJA and with a lot of our coalitions where, we cannot just focus on environmental justice and say, okay, we need to improve air quality, and we need to, center frontline communities. We also acknowledge that we need help, and that we need to collaborate with the labor movement, and the housing movement as well, and all these other movements, because ultimately we cannot get to, justice, to reparations, to a better world without all of these folks. So a lot of the work I do is, centered on reducing emissions from or eliminating emissions from the transportation sector. And a lot of it is really prioritizing electrification. But I know that we cannot get there, if we don't have the labor movement, right? If we don't have the mechanics, the bus operators also being trained, and that there are safeguards in order to protect them, we need to make sure that they're coming along for the ride. So, I think this panel and a lot of the work we do, we try to work, cross sector in order to, achieve justice. Yeah.
I think it's important for us to recognize it's easy to focus on health and specifically access to health care, quality health care, as being, one of the key drivers of health. But our evidence has shown that not to be true, is that most of what actually determines, not just whether individuals can lead their healthiest lives, but whether communities are actually healthy and thriving are happening outside of the walls of clinics and hospitals, right? What we know as the social determinants or social drivers of health. And so I think as health professionals, we need to recognize that all policy is health policy, that having a roof over your head, having access to safe, quality housing is necessary for us to be able to keep ourselves healthy, to be able to adhere to all of these other health behaviors and medications and treatments. That being able to get to a doctor's appointment is one of the first steps in actually being able to engage in preventative types of behaviors. And so when we think about access to transportation, access to safe, affordable, quality housing, the air that we're breathing at the moment, these are all, and the policies that influence all of these different conditions are important to consider. And, with respect to thinking about how do we develop solutions then? And specifically advocate for healthier policies that are going to improve neighborhood conditions and well-being. So I think the first step is to just expand what we think about as what it takes for individuals and communities to lead their healthiest lives. And that is only going to come from taking a holistic approach and having different sectors at the table to collaborate and ideate solutions.
Yeah, I fully agree with what Marlene just said. Sorry, what Dr. Camacho just said. Yeah, about collaboration and advocacy, specifically for populations that are typically not brought to the table. One of the things that I've noticed as an early career investigator is that a lot of decisions that we make and a lot of public health interventions that we put forth are very much top down. So it's very much, I'm an expert in this. This is what I think the community needs. Here's some evidence to support that. Why didn't it work? So I think one of the additional components of this is really uplifting the voices of the members of the community to really understand not only what their needs are, because I think we can talk about how people need affordable housing and how they need livable wages. We can talk about that because we know that that's true. But how is that actually going to manifest for that population? What are the ways that we can actually attain that for that population and bring them along for the ride with us as we're striving for those goals? I think the other thing that we're not necessarily talking about, which is a little ironic because we're at an academic institution, but is the importance of education and how we can reshape curricula to better focus on the needs of populations through the research that's been done or through engagement with communities. I think back to, I took a qualitative research methods class as a graduate student, which is not my area of expertise. And the faculty member brought in a group of folks who were formerly incarcerated and had a history of substance use. And just engaging with them and watching them do a focus group to discuss their experiences was incredibly eye-opening, not only about the qualitative methods, sure, that was the purpose, but really hearing their experiences and the things that they needed to avoid recidivism, to avoid going back to jail, was really eye-opening. So I think that's something that we can also consider is how we can uplift the voices of the community to ensure that, yes, our curricula are rigorous, yes, they meet the thresholds that we need students to meet in order to succeed in their chosen healthcare profession, but also to make sure that we're doing justice to the populations as part of those curricula as well.
Take it.
I have more to add in a second, so I'm gonna give my. The next question is.
Okay. So when we examine health inequities in urban settings, we are reminded that chronic disease disparities among racial and ethnic minority communities are not simply biological, which is kind of what panelists have been saying here. They're deeply rooted in systems of power, place, and social context, so social determinants. So this question is for Dr. Camacho Rivera. How do neighborhood conditions such as poverty, housing instability, and access to health resources interact with race, immigration status, and social capital to shape chronic diseases disparities in marginalized communities?
It's a great question, and it's the question that I use to frame my life's work. So I probably have a lot to say, but what I will say is that our neighborhoods, shape how we live, how we thrive, in very deep and meaningful ways. I think in ways that we don't necessarily even realize it, and that we take for granted. For example, we are all sitting here and able to contribute in these conversations because we are able to breathe the air that is currently all around us. As an asthmatic and having a child who is asthmatic, that is not something I take for granted because that is something that does not happen every single day. And yet, there are many neighborhoods where children are experiencing, the consequences of very explicit and deliberate environmental injustices that happen by design, right? It is not a coincidence that there are many major highways and freeways that go through predominantly Black and Brown communities within New York City and other urban areas. And so I will say that I think that, political choices as well as private investment and disinvestment, both historical and current, shape every aspect of neighborhoods that we live in. Whether we can walk safely within our neighborhoods, whether we're able to be outside and play and exercise, the types and access to the quality of food that we eat. I mean, the list goes on and on. But I would be, remiss if I didn't mention that every neighborhood has both challenges and strengths. And I think that when I think about neighborhoods, it's important for us to be able to recognize the strength that exists within Latino immigrant communities, Black communities, other immigrant communities, because the social connections, the social cohesion, the ability to build relationships around commonalities and shared identities, I think is incredibly important. I grew up in East New York, Brooklyn, which by most health indicators would tell you that there's a lot of work that needs to be done. And yet I knew all of my neighbors, and my neighbors looked out for me, and our families looked out for each other. And it's a tremendous source of cultural identity and pride for Caribbean communities here within Brooklyn. And so I think that, the ability to be able to come together to lift up assets and recognize the need to be able to sustain assets and strengths within communities through investment, through partnerships across different sectors, I think will go just as far, if not farther, as well as mitigating a lot of these injustices that we've seen as a result of political decisions and private disinvestment.
Thank you for the answer. And as you were talking, I was thinking about Hunts Point, right? Because when we think about asthma and where in the city is asthma highest is in the Bronx, is in Hunts Point. And the Hunts Point now is not what Hunts Point used to be, right? But when, I want everyone to think about when you're driving on the FDR and you look and you're going uptown and you look to your left, what are we seeing? We're seeing public housing, right? And it's our people that live there. So I think that, when we talk about highways, if you're going up to the Bronx, if you see on either side, I think these things were not made by chance, but made by design. And I know it's hard to admit it, but in order for us to have change, you have to admit it. And you have to accept for what it is, and that's where change comes about. Okay, thank you. So the next question. So as we all know, housing is one of the strongest predictors of health. And yet housing policy and public health strategies are too often developed in silos, ignoring the deep interconnections between where people live and how they live. From exposure to environmental hazards to overcrowding, eviction, and displacement, it is well known that unstable housing conditions directly contribute to poor health outcomes, right? So, my question, President De Leon, is where do you see the most significant disconnect between housing policy and health equity? So it's a two-part. And what would it take to close that gap so that every policy shaping where people live also supports how well they live?
Amazing question. These are not easy questions. Like we could spend like a semester on each of these questions. The reason I didn't answer the last one is because I knew this question was coming up and I felt that I can answer both now. I'll give you a little bit about myself. First, I have to update my bio because whoever wrote my bio is like one of my senior advisors from the past. We'll deal with that. But so I'll tell you a little bit about me. I'm a civil rights attorney. I was born in the Bronx when the Bronx was literally burning. We all remember the front page. And then that's when I moved to Washington Heights when I was 3 or 4. That is extremely important, and I never knew the importance of that experience because the building that we lived in, the boiler exploded, it went up in flames. I remember as a child, like being woken up by my mom and, you know, the fire department, all those things, and being homeless. And then moving in with family to Washington Heights. And so, you know, that memory was just there. The fact that we lost all our belongings, baby pictures, the works. What's interesting about that story is that I never realized until I, you know, became probably my 40s, the journey I had been on and how much that experience really affected where I ended up. So that experience happened, you know, went to college, became an attorney, became a civil rights attorney, state prosecutor. And at some point, I joined the Bloomberg campaign, which is where I met one of my closest friends who's sitting in the front row. Nobody knows who she is. And one of the things that my portfolio was neighborhood development. And if you think about it, you know, it's not typical for a civil rights attorney to sort of, you know, we're into like the civil rights and, you know, discrimination, and sort of what I did as an attorney made sense. But entering civil rights and the economic development piece of it, it's actually not as obvious, except for a civil rights attorney. Because if you actually take the Civil Rights Act, which is, by the way, one of the most amazing pieces of legislation, period, hands down, doesn't exist before or after it was created. And part of the reason is because of the fact that it actually addresses so many of the injustices that are part of our history. It addresses not just the housing aspect of it. If you know the US Department of Housing and Urban Development, it deals with everything that we're talking about here. It is one of the proudest moments in our history. Given everything that's happening in our country right now, it is one of the things that I rely on to keep myself going. Because our country was able to come together once to do and address actual injustices, so we could do it again. The thread is there, the history, the education. But I say that because in thinking about this question, the urban development piece, especially being from New York City, you think about HUD and all you think about is NYCHA, NYCHA, and NYCHA. And maybe there are like a sprinkle of things there. I don't know, Hurricane Sandy, right? But being an assistant secretary on the federal level and being someone who had the experience of a civil rights attorney, I thought I was going to end up at DOJ. I thought I was going to end up at the Department of Commerce. And ending up at HUD made me realize that the block and the neighborhood where I grew up was the block and the neighborhood where Jimmy Carter, who was president when HUD was in its infancy, came to visit. And so my world came full circle. I realized the importance of what it meant for a kid who actually endured and survived that experience, and the importance of us coming together and collaborating, not just on building housing, but building safe housing. building housing with health facilities, building housing with transportation is a priority. So you're not taking 3 buses, a train, and a car. And so that is what economic development is. That is what, neighborhood development is. So when we think about sort of like what is it that we need everyone at the table, and we have an infrastructure to do that. So, part of it is having the right people in the conversations at the table and doing this. But I say that because I am the result of a community like yourselves. I am the result of people that came in every day and fought to make sure that my family had the services and the benefits. So I want to thank you, because it is you and the fact that we're coming together to have this conversation. You're taking the time out of your day to know that everything you do every day leads to a success like me. So thank you.
Thank you for, thank you. And I think a lot of us can relate in our own ways of perhaps how we got to where we got, but thank you for sharing. So now, as we look at HIV prevention in Brooklyn, particularly among Latino and Black men, it becomes clear that this work is more than just data. It is about understanding how identity across race, sexuality, immigration, status, and economic realities intersects to shape real experiences with healthcare, stigma, and access to prevention. So, Dr. Diaz, how do intersecting identities such as race, ethnicity, sexual orientation, and immigration status uniquely shape the HIV prevention landscape for Hispanic sexual minoritized men in Brooklyn?
Thank you for asking this question. It's a question that I really love because it allows for hopefully a small teachable nugget of a moment that you can take away if you zone out after I continue talking. The key point that I hope you take away from this is that it's not necessarily the identities that shape health. It is how those identities are treated. So how we discriminate against individuals based on their identities, the social stigmas, the societal stigmas, the structural stigmas, and I'll talk a little bit about each of those, but how those all work together to break down populations. So if you're thinking about, oh, I see, for example, HIV is high among this population, it must be because that person is a member of that population. That's not necessarily the case. It's really the way that society treats people from that population that underscores those disparities. And that is consistent across all health disparities. It's not just HIV. So that's my teachable moment. And now I'll just ramble about other things that are related to that. And so I think it's vital that we consider the idea of intersectional stigma, which is that idea of how stigmas work together, not necessarily in an additive way. It's not, being gay and Latino means that you are twice as likely to have something happen to you. It's more that being gay and Latino might might expose you to even homophobia that a white gay man might not be exposed to, because that racism and homophobia are intertwined for those individuals. Um, so I think there's a real need for us to consider how these identities can differentially shape population health, because it's so fundamental to population health. And I think a lot about queer affirming spaces and how those spaces may not necessarily be welcoming to queer people of color. I have heard anecdotes after anecdotes. I've seen some research, but it's a real frustrating concern that we don't necessarily grapple with. We often grapple with the idea of queer affirming spaces should exist. We should have curricula that teach, LGBTQ health competencies, and that should be sufficient. But the reality is that that might be missing, that is missing, the populations that are sitting at those intersections. We're not teaching the appropriate health competencies for LGBTQ people of color. How do you treat populations from those intersecting, or patients from those intersecting populations? I could tell a personal story. It's not going to be as exciting as the personal story we just heard, but to keep it anecdotal, when I was looking for a doctor in Brooklyn, not necessarily that far from here, they were not affiliated with SUNY Downstate. I will say that they were not here, not part of Downstate. They advertised themselves as being queer affirming, so I was like, great, that's exactly what I was looking for. I want a doctor that I don't have to define things for. The experiences that I had in that office caused me to stop seeing a doctor for about a year and a half because I just couldn't deal with that kind of situation. It wasn't traumatic, it wasn't bad, it was just that invalidation of those identities that we had discussed and that I filled out forms to indicate were just completely invalidated through the actual conversations with the healthcare provider. And that was me as a post-PhD individual living in Brooklyn who understands the social determinants of health and did a dissertation on things related to the conversations I was having with that individual, struggling to have those conversations with that healthcare provider. So I think we also have to reflect on the need for those attention to those experiences of LGBTQ people of color, and that's why I think attending the differences, the differential experiences of individuals based on their identities is so important. The last thing I'll say, because I don't want to just be doom and gloom, even though that is my natural approach to life, is that one of the things that we're doing here at SUNY Downstate with medical students is we're trying to train them in LGBTQ health competencies. We have the LGBTQ health pathway, which is a really phenomenal pathway that I'm a mentor for, and it's really student and faculty, but really student driven. And the unique aspect about that, because you can learn about LGBTQ health competencies in a variety of settings, but it's happening here at SUNY Downstate, where the patient population is predominantly people of color. It's predominantly immigrant individuals. So I think even if it wasn't the intention of the pathway, it's manifesting that attention to intersectional identities in ways that you might not be seeing at other institutes that don't serve those populations. So I wanted to give a shout out to the LGBTQ health pathway and to not end on doom and gloom.
Thank you. So, Kevin, you're next. So, when discussing environmental justice in New York City, it's essential to recognize how race, class, immigration status, and urban planning intersect to shape life in vulnerable neighborhoods. Transportation corridors and air pollution disproportionately impact low income communities, as we all know, and it makes the city's environment health deeply connected to issues of power, voices, and equity. So, how do overlapping access of race, income, and immigration status affect which neighborhoods bear the brunt of pollution, congested traffic, and infrastructure burdens in New York City? So, if you were to sum it up, the question would be which neighborhoods become sacrifice zones and why?
Yeah, thank you so much for that question. I think one thing to acknowledge that, was mentioned earlier is design, right? Like, how are we planning our cities? So we have to acknowledge that there have been historic policies that were unjust, redlining, exclusionary zoning as well, urban renewal, that really have shaped, not only how our city looks, but where people live, where people work, where people go to school, things like that. In the same communities where we see these polluting infrastructures, right? When I think about transportation, highways, ports, now these e-commerce mega warehouses that are trying to meet same day, next day delivery demands. There's also other polluting infrastructure, right? We have Department of Sanitation, garage trucks. I mean, we have one like a block or two away. But we also have what are called peaker plants. So these are power plants that, during the really hot days, during our heat waves, they can bypass emission regulations. So they flip a switch and they emit some of the nastiest air because the grid needs that power. We need to make sure that people are, getting the electricity they need in order to power their ACs or to keep people cool. So what happens is also, a lot of the land, that is in manufacturing districts that have been zoned for, industrial uses tend to be some of the cheaper land, but also this is where some people tend to live. Rents tend to be lower, and communities of color, low-income households tend to live and have historically lived there. Um, and these are the same communities where you'll find some of the greatest injustices, right? You'll find the least amount of environmental amenities, including open green space. You'll find the least amount of trees. You'll also find the least access to public transit. So what we're also seeing is, these are the communities that suffer the most from urban heat island effects, but also suffer from the highest rates of asthma and other cardiovascular diseases. So what we need to be making sure that we're doing is that when we are making investments or prioritizing policies to improve air quality or communities, that these are the communities that are on the front line or being prioritized for that. Yeah.
So let's see. Hmm. I have another set of questions, but I don't. Maybe I'm gonna mix it up. I'm gonna open up the floor because I think we've said a lot, right? And I know that these conversations seem serious, but it's not that it's serious; it's that it's real, right? And I think that uh, it would be good. I'm gonna open up the floor. Anyone has any questions or comments that they'd like to pose to our panelists? Now would be a great time because I don't want anyone to leave and not have a question, and then I'll go back to my questions. Great. Who's going to work the mic?
Thank you very much for this wonderful and necessary discussion. Being that this is an academic institution, my question is essentially, what advice do you have for students who want to make a difference in healthcare and or community leadership, and carry this work forward?
I'll go first. Um, it's I wish this weren't the case, but the honest, what we all know to be true is that none of us are educated on the injustices that we're talking about. None of us. It's only people who take it upon themselves to be exposed to understanding and learning why things are the way they are. If you go through your education and continue to meet all the requirements and don't take the time to understand what it is that we're talking about, you will continue to be oblivious to it. And I personally think will not be as effective. But more importantly, it'll continue to build the frustration because you just won't understand why it is that you're hitting certain walls, why you're hitting certain things, why your patients are not doing certain things. It's only when you take it upon yourself to learn about the things we're talking about. Redlining wasn't just about the banks redlining neighborhoods to ensure that they paid the highest interest rates or were denied mortgages. That was one of the things. Redlining neighborhoods also meant that those neighborhoods did not get resources. When you think about affordable housing and when you think about what happened with housing, government was implicit in ensuring that certain neighborhoods didn't get housing. And so when you think about even our own city, our beloved city that we love so much, and you think about how it was that Central Park was created and Lincoln Center. And when you think about, in East Harlem, when the Department of Sanitation didn't pick up, the garbage for God knows, talk about health issues. So for me, the number one thing, especially entering the world of education, is for everyone. If you have and can take the time to learn, whether there's a professor, there's a class, CUNY teaches, SUNY teaches, we have amazing faculty. We are lucky that we live in a city that actually provides this information if you actually want to take the time to learn about it. So
Um, I will also just say to our students that you come in with so much knowledge and expertise before you ever step foot into any classroom. I would always say that the reason why I came into public health and why I focused on health equity was because I probably felt like I had a graduate level degree, a master's degree, if not a PhD in health inequities because of my lived experiences, growing up here. And so I would say I think it's important, yes, to continue to learn and also ask questions. Interrogate why we're learning what we're learning and what is being left out of the curriculum, and really thinking about how we can continue to push and advocate for everyone, regardless of whatever degree program they're in, whatever institution they're attending, to make advocacy, to make community organizing, to make understanding political processes and how legislation is made and can be changed in this country required, because that is shaping the way that we conduct our science, the way that we practice healthcare, the way that we are able to teach what we're teaching within classrooms. And as has already been mentioned, what can be done can be undone, right, with the right legislation. And so I would just say to continue to advocate for pedagogy, for curriculum that is really rooted in assets and community organizing, that is anti-racist, that is decolonialist. I mean, we can go on and on about so many of those other topic areas, but I think that part of it comes with being open to learning beyond your disciplines, and then thinking about the integration and also the interrogation and empowerment to ask new questions about the way that we're moving our disciplines forward.
And I just have a quick addition to that. I think the other piece of that is also being comfortable being wrong. So we learn by making mistakes. And it's when we approach things with an open mind about our wrongness that we're able to learn those new lessons. Sometimes they're hard lessons. I mean, I think about how little medical education has covered trans health, for example, for a long period of time. And what has the curriculum done to address that since then? How have the students propelled that forward alongside faculty that have supported that? But how much of that has been student-led, and how much of that has been driven by folks that have recognized a gap and have been able to build collaboration with faculty that were interested in promoting that as a part of the curriculum, but also among other faculty that would then be involved in that process. So I think it's not only, I know the question was sort of directed with students, but I think we as the people sitting on the other side of those conversations also need to be comfortable being wrong. We stopped learning all the new information a long time ago, where the younger folks are bringing that information to us. So we need to be willing to, obviously respect our education and respect our expertise, but be willing to see those new lessons for what they are and learn from those new lessons as well.
So I'm just going to make a little, I'm just going to share a little bit from me. So not to plug public health, but how can you not? So, as a doctor, I felt that the clinical aspect, right, in my lived life experience as a minority woman in medicine, um, was all great, right? And I think there came a point when I started doing a lot of community advocacy where I felt, and I had this conversation with Marlene, I guess, when I said, this is what I want to do is get my MPH, where I felt that that's what was missing, right? So your lived life experiences, it just brings you so much to that edge where you're like, there's something that's missing. And for me, it was that. And when people say, how do you balance, all the things that you do and also getting your MPH, I will tell you that whenever I'm in my classes, it's like it makes sense to me, right? Um, and I think that the biggest mistake anyone can make, and I think we as minorities make, is that, oh, school is too long, expensive. How am I going to find the time, right? But we have to educate ourselves, because as we educate ourselves, we start to see the world that we're walking through in a very different light, right? So, when I do any work with my residents and my colleagues and students, when it comes to community advocacy and we talk about program design, I was doing it before I knew what it was, right? So it becomes very intentional. And I think that it would be horrible if we do get educated, but we don't go back to our communities and have that sad conversation of what's going on here, right? And I have the education, so how do I make my community better, whether it be through transportation or housing or sanitation, because one is to get the degree and the other is to use the degree the way it should be used. So, thank you.
I know it's probably, I just have to use this example because, thank you. Because I feel like it's a good example to show that a lot of this also feels overwhelming, and your actions don't have to be, don't have to address, you know, the sun, the moon, and the stars. So my nephew is actually going to medical school right now, and I give him a hard time all the time. But he said something to me the other day, and you know, it was so touching because, of course, he's in the Heights. And one of the things he said, he was like, you know, I asked him, how's it going? He was like, oh my God. He was like, Dominicans are coming back from the DR, all the elderly, you know how they come back. Because, you know, for the winter time, they go, yeah, okay. So they're in DR and they come back. And he said, and it's unbelievable. They stop taking their medication. They go visit a doctor in DR. The doctor tells them to take something else. He's like, they come back and it's like a brand new patient. Like, and so what his classmates or residents, I don't know what you guys call them, but what they did is that they came together and they created like 5 questions that would get this information. Like, did you just come back from DR? Did you visit a doctor in DR? What medications did they give you? Let me see what they gave you. As a way not to argue and start like, but why aren't you taking your medication? The last time I saw you was 3 months ago. And that alone, so they sent an email to everybody, to like each other, guys, reminder, all the seniors are coming back from DR, and you know how it goes. We go through this every year. And I couldn't, but I was like, oh, it was just surreal that they came together and they're like, let's make our lives and the patients' lives easier, and let's just get the information and not get frustrated because we know what they do. And so just wanted to share that example because it doesn't have to be insane. It could be like, folks, reminder, these guys are coming back, you know, it's like the after school program. So.
And sorry, I just have one quick shameless self plug. I'm one of the principal investigators on a NIH R21, specifically looking at something like that. So it's looking at how geographic mobility, movement, yeah, I can help out, but how that can impact HIV prevention and HIV treatment. Because similarly to what you're talking about, you know, traveling to visit family can impact your ability to take your medication with you, or maybe you have easier access getting the medication while you're there. So that's one of the things that we're looking at, specifically in queer, immigrant, Latino populations.
Trust is so important for healthcare. And right now we're living in a time when, Don told me to stand up, so I will. We're living in a time when our people in our communities aren't leaving their homes out of fear, and people are afraid to walk down the street. And so there was already a distrust of institutions, especially healthcare institutions in our communities. And I'm afraid this is just so much worse and probably the lowest point in my lifetime. How are we, I know this has got to be affecting the research you do and the care that you give. So what are we doing to rebuild that trust at probably the most horrible time possible?
Ooh, I would say that we spend a lot of time in medicine and in public health talking about trust and mistrust among individuals, within communities, and trust and mistrust is oftentimes used as an excuse. We can't engage community members in X, Y, and Z, or this intervention was not successful, this program has not met its milestones, and it must be because this community doesn't trust us. They're mistrusting of science, they're mistrusting of public health, and that is completely wrong, first of all. And it's also just victim blaming. I mean, I think it completely removes academics, public health professionals of the responsibility that we have to be trustworthy within communities. And we don't have to think about the US Public Health Service syphilis study as a historical example of why, Black and Latino communities might be mistrusting, because there's current examples that are experienced every day. And so when I think about trust and mistrust, I think, what are we actively doing as hospitals, as academic centers, to be worthy of trust within Latino and immigrant communities? Because a little skepticism is actually healthy and protective when you feel like an institution or a particular individual may not have your best interest at heart. We've seen this from medical experimentation of reproductive drugs. We've seen this in forced sterilization, not just in Puerto Rico, but in ICE detention centers all across the United States. And so, happening just a few years ago. And so, I think we need to have those conversations. And part of the way that we can think about gaining trust and being trustworthy, one is acknowledging the harm that has been done, and being really transparent and having conversations about how we can restore trust. Some of the ways that we can restore trust are actually going out and engaging directly with communities and having conversations about how can we serve you beyond just our own agenda, beyond just our own vested interests. What would it mean for us as an institution, for us as a hospital, to actually be serving Latino immigrant communities? And a lot of the times we'll find that that might be moving beyond just thinking about healthcare to helping to address social needs, to help advocate for better conditions. But it also comes with meeting people where they are, and recognizing that the onus should not be on individuals alone to address these broader systemic barriers. So if you're afraid to come to Downstate because you're worried that you will be detained by ICE, Downstate should be thinking about developing home visiting programs, which we have had, right? To be able to address mobility issues and things like that, or working more with trusted community spaces to be able to bring care to people beyond these walls. That can be done for other public health programs. That can be done for educational initiatives. So I think, engaging in those conversations, engaging in activities and advocacy that moves just beyond our own individual purpose in true service and purpose of communities, and thinking about what we can do with respect to restorative practices to become more trustworthy.
We have another question over here.
How you doing? I'm a pediatric hospitalist. Most of the patients I take care of have respiratory issues, asthma being a big one. Latino children suffer higher rates of asthma than any other group. How can communities, local leaders tackle these issues on? Most of this is due to housing issues. Most of this is environmental issues. What can we do about that?
Yeah, thank you so much for that question. I think what's really important is that, when we are thinking about the positions that we are all in, that we should be working with community-based organizations to look at the solutions that they are proposing. A lot of these communities already have community plans. They already have solutions for how to reduce emissions. And I think working with them is super important as we look to reduce emissions. So New York City Environmental Justice Alliance, we're a membership-based network of grassroots organizations. We have 13 member orgs across the 5 boroughs that have come up with solutions on how to improve air quality, how to improve the quality of life for many of their community members. And they work directly with their communities. The reason being because they abide by the Hermes principles, where, and so does NIJA, where I, have to respond to my members, who then have to respond to their community members. And, they know their community best. They have their lived experiences. And a lot of times, we need to be making sure that we're uplifting their solutions. So one perfect example is, congestion pricing by the MTA. A couple years ago, they came out with their environmental assessment, and it was very clear that regardless of the tolling scenario, there were projections in truck traffic and tailpipe emissions, particularly in the Bronx along the Cross Bronx Expressway. Um, NEJA, was a part of what was called a environmental justice technical advisory group, where with other environmental justice groups, we were privy or gained knowledge of some of this information about 48 hours before it became public, so that we can share that with our community members, and sort of be that additional layer of explanation or translation. So one of the things that we, raised the flag about is, well, you can't go forward with this plan if you're creating that sacrifice zone of the South Bronx. So we came up with, along with our members and some of our allies, a list of, policies to, not only mitigate that, but also achieve a net positive plan. So not only reducing the emissions to break even, but going beyond that, because the South Bronx and many other communities in New York City and really across the nation deserve that. They need to be given that. We need to repair the harm that has been caused to them for so many decades. So I think, working with those community-based organizations in order to, uplift their solutions and working on their campaigns, yeah.
I that was awesome. But we could do this all day because I love. Um, One of the other things I think would be to partner with the Department of Education, and part of it is because I think what Kevin is addressing is really like a neighborhood community, but there is a lot that happens within the home, and there's a lot that happens when the children are not at home that we're not aware of. So I would say it would be amazing to have a partnership between, the medical association. I don't know, Dawn's like, I don't know, Dawn's like giving me more work. Great, thanks, Elizabeth. But yeah, because I, even myself, right, where I'm a president of a community college whose students are coming from these communities, I have 500 questions right now about like how are we addressing that, educating the student, educating the people in the home so that they become better advocates for themselves on a daily basis, and also, in a much wider sort of, level. But I would love to see that. So
Good afternoon. So many good nuggets. I gotta stand up. I'm like 5'9". Okay. Sacrifice zone just hit me. That was a gut punch. Just hearing that. The other gut punch was Dr. Diaz when you mentioned you being educated, going to a doctor, and not going back for a year and a half. You're young. Imagine, yeah, just accept it. Um, imagine now our older adults that maybe, Titi Abuela is at home and they have the same experience and they don't go to the doctor. Misdiagnosis, missed diagnosis, and all the things that go into that. So that's where going into the homes is important, and the things that we need to do. And having community partners that we do work with, for instance, at Downstate, where we connect and do outreach. Something that we are working on, our new interim chair, with pediatrics, bringing DOE into the building. And we're going to go school district by school district and do clinics and do information on vaccinations and all the above that can go on, because we are missing those moments that can be a misdiagnosis, like this gentleman mentioned, to segue into my conversation about asthma. But then we're talking about diabetes and high blood pressure, which is heavy hitting in all immigrant populations. But in the Hispanic community, how are we working on bringing those support efforts to take care of that issue? And like we know, I'm Afro Caribbean, part Trinidadian, and Southern, and everyone has a bush or a tea. So we go home, we go back. See, he's like, yeah, you go back home, you come back in the summer months, and go to your doctors. I just saw someone in a restaurant said, "Oh, my mom wasn't feeling good. She came to Downstate. She got her medicine, and the swelling went down. She's going back home." I said, "Well, so what's going to happen in between?" you got to keep in contact with me. I need to know who the doctor is because now she's going to go in the backyard, pull a guava leaf, a sour sap. I know the bush, and then boil it, and then something could work, could not work. Get a different medicine, and now we have a collision, a reaction. So this idea of the 5 questions, that is the conversation we need to be having going forth in all communities and knowing the key terms of the pet names we call for illnesses because we know sugar is diabetes. I didn't know that I had that in my family until I was like 21 because it was given a pet name. So how do we just create that conversation that will allow us to take care of our community as a whole?
Dawn, do we have time for another question? Yay.
Well, bringing this back to the Latino community focus a little bit, how would you, how do you think the healthcare providers can do a better job honoring the family culture and traditions that are so central to Latino communities, especially in the areas where we've talked about trust? But yeah, if you have anything more to add.
I'm just gonna. So I think, what we're describing and what you're asking is cultural humility, right? I think the most important thing is that we in the medical profession have to understand that it's not us versus them, right? And although we are experts in medicine, they're experts in their lives. And having like when a mother says, no, I know, yo sé lo que tiene mi hijo. Like, I don't care what you say. I know my child. I know something is wrong. Not saying, oh, this is her baby, or, I didn't understand what she said. So first is cultural humility, understanding that it is a relationship. It is a relationship. We've known them for 20 minutes or 2 or 3 years. They've known themselves all their lives, right? Um, Having the conversation, to your point, Alicia, which is like bush tea, right? So we have the same thing in all our countries. And tell me, what other medications, what teas? And once you start having that conversation and you say, well, what else do you perhaps take from back home? They'll say, oh, so so let me tell you, right? And not saying like, oh my God, you can't. Saying, well, why? And how does this make you feel? And let me tell you about the medication that I want to prescribe and how it works, similar to that one. Because trust me, when I go to the Dominican Republic, it's like the office is open and everyone is like, let me ask you, let me see that. And they're like, I got this. Like, who knew penicillin is like you could buy it in a, yeah, you could, yeah, in una farmacia, in a pharmacy. You're like, but you need a prescription. No, you don't. Um, so I had to kind of sit and say why, right? So I think cultural humility, understanding, and having that conversation where although I am the doctor that you highly respect, I have to respect you as a person, right? And once they feel that you respect them, everything changes. Everything changes.
I totally agree. I think that not just cultural humility, but creating culturally safe spaces is important to be able to open up and to start asking many of these questions. I think again, not being dismissive when folks are engaging in additional healing practices. That, by the way, many of them Indigenous peoples, they just happened, and much of what Western medicine is founded on is based off of historical indigenous and traditional practices that don't get credited within medical curriculum. And so rather than being so quick to dismiss the teas or the prayers or anything else, I think recognizing that if it's important to the patient and it's important to the family member, then it doesn't necessarily have to be an either or conversation. It can be an affirming, acknowledging, and this is important to you. That's great. Keep doing what you're doing, and let's have a conversation about what I can do to help, move you further along. I would be remiss if I didn't mention language. Language alone is not, sufficient, but oftentimes it is necessary to be able to have a conversation, right? So I think paying attention to differences across languages, right? Because when we're talking about Latino communities, what is one word in one, group could mean something very different in a different group. And so acknowledging when you don't understand what this word means and can have somebody explain. Oftentimes, if there is another family member or a friend there, just opening up the conversation a little bit more to, again, say, I'm not sure what you mean by that. Can you explain further? Rather than being so quick to dismiss it, because that could be the difference between, shutting down a conversation or missing a key piece of information, in this person's health. So I think that language and cultural nuance and context within language, I think, is also really important to recognize.
I just want to add, so a plug for a movie I watched literally this weekend, Brownsville Bread. If you haven't seen it, I have to tell you, it's just this conversation here is, especially for healthcare providers, that would be a good movie for you to watch, and it's available.
And I just have one. I want to make sure that we have time for the last question, but I have two small points to make, and I've already forgotten one of them, so I'll make the second one first and hope I remember the first one. One of the things to think about when you're thinking about cultural humility and the importance of family and all of those aspects is also, what does family mean to that individual? So we often think about family being biological, natal families, when we're thinking about the queer and trans population, who also they can also be immigrants, and they might also have similar health concerns to, non-queer and trans individuals. But what does family mean to them? What do their transnational networks look like? What do their local networks look like? Who do they consider their family members? So I think that's another piece of cultural humility that we often forget because we think of joined through some other sort of ceremony. So I think there's that other piece of cultural humility that we often lose in the conversation. And the other thing that I was going to say was about something that you said that I cannot remember. So it was not insightful. Thank you.
Yeah, my question is twofold. One is, how do we reconcile the what's done? So I live in East New York, and the Bell Parkway is not going anywhere. And I can count like 3 sanitation depots in my neighborhood, and that's not counting those areas that you can bring your garbage to. You pay to dump your garbage, and it's a whole bunch of dust that comes up in the neighborhood. And then also, Amazon has like 3 or 4 new big warehouses there. I mean, it helps to get my stuff, on Amazon real quick, but I mean, it also causes like a lot of pollution. And the other question is mostly for Kevin, is like, I feel like I've been recycling before recycling was in vogue. But then, like, I was talking to my neighbor. We live in a row of private houses, right? And right across the street is like the 3 floors NYCHA developments. And they're talking about finding us for not recycling properly, but then they don't recycle at all. So, what's the policy?
Yeah, thank you for that question. I think to your first question, the most important thing is acknowledgement. Acknowledgement that the harm has been caused and that there needs to be repair. You know, a lot of lawmakers, city, state, and federal agencies are coming to that realization and are trying to do that. But it's also important that we have laws and policies that are adopted that mandate, investments in repairing these communities. So one perfect example is the climate law that was passed in 2019, the Climate Leadership and Community Protection Act, the CLCPA. I was not a NEJA, but my boss and some of my other colleagues were. But really, what it does is it requires economy-wide emissions reductions, but it also requires that at least 35% of investments in renewable energy, in climate resilience infrastructure needs to go to what are state-identified disadvantaged communities. So these are low-income communities of color or frontline communities that have historically been disproportionately impacted by, heavy polluting infrastructure or suffering the harm of, our fossil fuel industry. So I think that's really important. That's always the first step, because then we can, sue the state or sue the city, when these mandates are not being met. I think when it comes to recycling, I've also been a big recycler as well. I was making my parents recycle at a really young age. They were like, "Yeah, that's cool. Whatever, we'll do it. It makes you happy." But it's very important that these policies are not just enacted, but also the education, right? And sort of like what was being said here earlier, is meeting people where they're at, right? Teaching people how to do it. One new program that's come online is the organics or composting program. A lot of people were not happy with it. They thought, oh, I have to go through my garbage and pick out any food scraps, any soiled napkins, cardboard boxes, or like pizza boxes. And I was like, no, 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 you just put that off to the side, right? And then, you put it in a separate bin, the brown bin. It's really education and meeting people where that, but then reminding people, of these programs. I know sometimes in buildings, we have, people who move out and then move in. New York City is, notorious for that. Reminding people like, hey, these are the programs that are in place. We have recycling. This is how we separate, metals, glass, paper, etc. And we also separate composting. And this is how we do it. And it's very important to do this, not just because it's the law, but because we have to, we're in the middle of a climate crisis, and we need to do everything we can in order to reduce emissions and improve the climate. Yeah.
What's worked for me, because I'm sort of in the same situation, I found out who my sanitation department is. Like they have regions. Mine is 9, so every single region has like, I DM them. And believe it or not, it's worked. Like they respond, right? And you can DM sanitation. You can DM all the different agencies and say like, why is this happening? And it's short, quick. I don't know how to DM, but my niece does it. But it's worked. I'm like, use the, and it's worked. So I'm just letting you know, you're frustrated, like DMing seems to work. So that's what I do.
Can talk a lot after. So our time is up, and I don't know who said it. I think it was you, Liz. That we could do this for another hour, hour and a half. This was great. I want to thank all our panelists for bringing their expertise, but more important, bringing your personal stories. Right. I think a lot of times when people are on panels, it's very much I come from and I represent, but we come from and we represent, but it's who we are. And I think being able to tie our personal stories of where we live or how we grew up or what we experienced into why we are where we are, what makes us passionate in terms of what we do is especially important. And of course, I'd like to thank our audience in person and those that are being live streamed for joining us. Um, hopefully, this will not, just a simple ask. Hopefully, this will not, Dawn, be the last of discussions like this. Um, but I'd like to thank everyone. And like I said at the beginning, what a beautiful way to close out Hispanic Heritage Month. And thank you. Thank you for joining us.
Just to reiterate what Dr. Guillen said, thank you all, everybody, for being here in person, online. For those of you who are here, understand the importance of these conversations, and we really appreciate you coming out. Quick plug, next week we're doing one on domestic violence awareness, so we'd love to see you there. At the end of today's presentation, please stop by and grab your Hispanic Heritage t-shirt. It's orange, just saying.
That's your favorite color.
It's my favorite color. Everybody knows this. And I really want to thank our panelists. Kevin, thank you so much. Appreciate it. Special shout out to Eddie Bautista, another friend of ours from City Hall when we worked together, mine and Liz's. Dr. Camacho Rivera, she's always, always, always on point, always ready to jump in, and we really appreciate you. Dr. Diaz, my first time meeting you, I feel like I've known you forever. So thank you. The Downstate family is in the house, okay? Yes. And to my friend Liz, now president of CUNY Gutman. I'm so excited. I'm very proud of her, and I'm very fortunate to know her. And it is not without um, a great sense of appreciation that I can call on my friends across the board to make sure that we all get the messages that we need to. So if you've got friends, remember who they are because they each bring something valuable to the work that we do. And I appreciate you all so much. Dr. Guillen, fabulous job. Thank you. She was incredibly nervous, but you would never know it. So thank you, everybody, and we'll see you at the next one. Have a great day.